Welcome back to Great Day. It is American Heart Month, and we've been talking about it all month long. Last week, of course, we focused on heart disease in women, and this morning we're going to talk about heart disease in men. Dr. Andrew Cates, a Washington University cardiologist at Barnes-Jewish Hospital, joins us now with more information. Happy Heart Health Month, Dr. Cates.
Thanks. Happy Heart Month.
Yeah, I know. I tripped over that one too. Listen,
I'm still getting over the excitement of learning about mosquitoes. So,
well, we all are. We all are. Our heart rates are up. Listen, it's a very serious topic, and it's a cause for a lot of death in men, and we talk about that as a leading cause of death for women as well. What are the numbers? How often do we see this?
That's great. Well, great. First, thanks for having me on to talk about this. But you're right. When we talk about cardiovascular disease, which is coronary artery disease, heart failure, hypertension, or stroke, nearly 50% of individuals over 20 have one of those conditions. And importantly, about 1 out of 4 men die from coronary artery disease. So it's the leading cause of death in men. Importantly also, though, we know that about half of men who die suddenly from heart disease don't have any symptoms beforehand. So with that, it's important to understand prevention, so knowing what your risk factors are and also knowing what warning signs and symptoms are for heart disease.
And I think that's what scares a lot of people, is that we do hear about people just dropping and there was no sign, they seemed to be in perfect health, and then they had a heart attack or whatever. What can we do to try to control that risk?
Great. So importantly, understanding if you're at risk for it. So knowing if you have risk factors, if you have high blood pressure, if you smoke, if you have diabetes, if you're overweight, if you have a family history of early coronary disease, if you're under a lot of stress, other factors like that are important risk factors. And we know that will increase your risk for having a heart attack, having a stroke, and having heart failure. So beyond knowing risk factors, though, knowing what the warning signs are, knowing the warning signs of heart disease, chest pain symptoms, chest pain that happens with exercise, shortness of breath, symptoms like that, knowing the symptoms of a heart attack, chest pain that doesn't go away, knowing symptoms of heart rhythm problems like palpitations, feeling your heart racing fast, symptoms of heart failure, shortness of breath, swelling, knowing what those symptoms are and those warning signs so that you can act upon it.
You know, it seems to me, in my mind, I'm paralleling this when we talk about women at a certain age should get their first mammograms, and we all at age 50 should be looking, whether we have a risk or not, at getting colonoscopies. And it's going to be different for people that have maybe a history of breast cancer or any cancer or heart disease in their families. But is there an age that we should really start to focus on our heart health more than
you know, that's a great question. You know, there's no age that it's too early to start thinking about a heart healthy life, and we know that the building blocks for heart disease happen early. So even in your 20s or 30s, even earlier, we know that childhood obesity is linked to higher rates of heart disease as we get older. So it's never too early to start thinking about your risk. We know that the risk of heart disease does go up in your 40s and 50s. But starting early and thinking about heart healthy lifestyle, and we can talk about that in just a minute, but thinking about ways to live a heart healthy life really starts even earlier. But we do see, especially men in their 40s or 50s, when we start to really think about, we know of our friends or our fathers or other people who develop heart disease at that age, and that starts to trigger our concerns.
Dr. Cates, thank you so much. I wish we had more time. We could talk about this all day. It's of particular interest to me.
Just a quick plug, though. So be active, remember, exercise, eat healthy, know if you're at risk. If you smoke, quit, don't start smoking. And really, again, ask your doctor, talk to your primary care, talk to a cardiologist, and really get more information. Thanks for having me on. I wish we had more time.
I do too. Thank you so much. Great talking to you. You can find this segment, by the way, if you'd like to forward it to some of your friends and maybe say you need to take a look at this, maybe with the history you've had in your family or something like that. We don't want to alarm people, but go to KMOV.com/greatday following the show, and we'll have this posted.
Great information.